on, and we're going to start the video. Oh no, I don't want to share camera, so let's just share screen. And then you'll see me toggle around. It's just going to be a hot mess, but it's okay. All right, so video is not coming up. Why is the video not coming up? All right, so I'm having technical video difficulties for some odd reason, but hello, everybody. I am doing a webinar to go over open enrollment, and I'll be posting this video. I'm going to share my screen now. Here, we'll do the camera so you can see what I look like. All right, I'm waving at you. There we go. Now we're going to share the open enrollment screen. All right, so it's open enrollment time, right? And a lot of times you may choose benefits just because you're looking at your premium and you're trying to decide which one should I go with, right? Some employers, if you're an employee, they offer a gambit of different options, and then some employers don't. They offer you one or two. They may offer you a HMO and a PPO, or they may only offer you different HMO levels. So they start at bronze, silver, platinum, and all that means is really coverage, right? So the color of the plan says that you pretty much will have more coverage, and we'll go through that as you know, it crops up. Okay. Too bad I don't have people on the call, because then you could ask me questions as I'm going through, but we'll talk about doing that later. So the objectives as you're going through this webinar is to understand and accessing your options, what that looks like, knowing the difference between enrollment periods, deadlines, and effective dates, premiums versus out-of-pocket costs, and aligning your insurance needs with affordability. You should have a better understanding of all of those things that I've listed in the objectives once you walk away from this webinar. I will include my contact information, email, Instagram, LinkedIn, and there's one other one that's on there that I don't remember, but it'll be on there, and then you can always reach out. Email is kind of the best way, and my telephone number is on my website, which I can always share later. All right, so what do you need to know? Understanding and accessing your options. As I said before, you know, depending on your situation, if you're an employee and you have an employer who's providing health benefits for you, you may have several different options. If you're self-employed, you're a contractor, you're trying to just think outside of the box here, there are many different ways that you can access the, or you may have access to different options. For some people have a spouse who works a full-time job or a part-time job that offers them benefits, and you're trying to sit there and figure out, you know, or you may have a job that offers you benefits and you're both trying to figure out, you know, here we go with those apples and kumquats, which one makes more sense for the family? Are we growing? Are we downsizing? You know, what stage of life are we in? So there's that this way and that. As I said, employer-based options are usually what a lot of people see. If you don't have an employer-based option, if you're a contractor, an entrepreneur, or a business, then there are options under the Affordable Care Act or the Healthcare Exchange to, as a business, to look at, you know, plan options, and then as an individual or family member or family to look at plan options. And then there's finding insurance through a broker and an independent insurance carrier. Independence Blue Cross has their own website. United Health, I think, has one. And then there's several. There's one that just cropped up in Pennsylvania, and I cannot remember the name of it because it's relatively new. But that is one of the options that you have now. And we can talk about that. So you have 3 doors. Which one do you choose, right? Let's go back to that. It all depends. It all depends on what your health status is, how you use the health coverage that you had last year. Did you really use it? Was it, and if you didn't use it, why didn't you use it? Was it because you had a high deductible plan and you were worried about your out-of-pocket costs? Was it because your family is relatively healthy or you're relatively healthy and you really didn't need to use it? Those are things that you really need to kind of look back on as you're entering into the enrollment period and really think through, because yes, your premium, that's your out-of-pocket cost every month that you're looking at. But you also need to think about, your copays and your deductible, because that's going to affect just the decisions that you make when you're going to use, not only choose, but to use the coverage that you have. So you want to make sure that affordability is one thing that you have in the forefront of your mind, but it's not just right now affordability or short-term affordability. This is what you're going to be using for the next 12 months, starting in January. So am I really going to maximize the use of this coverage that we are taking on, this financial burden? So there's that. Now, with that comes the open enrollment period or the enrollment period deadlines and effective dates, because they're all different, right? So there's a period of time where, you have to enroll, and then there's the deadline where you have to get things in, and then the effective date. So we'll flesh that out. The enrollment period, a period of time, usually but not always occurring once per year, when employees of companies and organizations may make changes to their elected fringe benefit options. So not to sit here and read to you, but what that pretty much means is there's a specific amount of time. For the ACA, it starts November 1st. It closes on December 15th. For some employers, they may start October 15th and close November 1st. So it just depends on the time frame, and it's really just a time frame, right? So it's from this point to this point. That's the period that you have to enroll, make changes on these benefits. And as I said at the bottom, changing your healthcare and eye care benefits would be an example. You saw last year that, the eye care benefits that you had didn't really take care of what you wanted to get done. It didn't cover glasses, or it didn't cover frames, or it didn't cover lenses, or you wanted transitions and it didn't cover transitions. So now you're waiting to change that benefit, and then you want to go in to the doctor, the eye doctor, and start really using those benefits. Deadline, as I said, starts, ends. This is the last date, the last time to which you can complete this process. Nice and short and simple, right? And the effective/active date. So the effective date, which is the date upon which something is considered to take effect, is or active date. They kind of are synonymous with one another. It pretty much means you may have this enrollment period and this deadline, but those deadlines and enrollment periods may not coincide with the actual effective date. So most insurance changes occur before they go active. For instance, again, ACA, it's all out, it's out there. It's something you can talk about, and the period is a little bit longer than some employers. So the ACA, again, starts on November 1st. Healthcare.gov opens up, and so do a lot of the independent insurance companies, and then it closes on December 15th. Well, those benefits that you chose in that process, they don't go effective, or they're not active until January 1st of 2019. So there's that period of time where if you didn't have coverage, you're still not going to have coverage, or if you had coverage and you're making changes, those changes won't go effective until January 1st. Premium versus out-of-pocket cost. So this is a big one. This is something where I think most people weigh in on the premium piece, that piece right there, and they don't really look at what the out-of-pocket cost may be later on in the, in the long run, or when they go to the doctor, what those copays look like, what is deductible. Oh my gosh. So let's talk about that. All right, now here is an example, and this is just something I pulled off of the internet, where Aetna Gold, remember those colors we were talking about, where you have gold, you have silver, you have platinum, you have bronze. So these are kind of just showing you from an employee perspective, and I have a couple of slides that goes over this. It's what are you paying for, your health plan. This more looks like, it is the HSA. Okay, great, because I was like, this is not what a premium looks like normally. So as you can see, the employee pays less than if it's an employee and a spouse, an employee and children, or an employee and family members. And that is pretty much standard for most plans. And you can see it's like, okay, if you don't smoke tobacco, then you're going to pay less than somebody who does use tobacco. And, if you're going to opt in for wellness and tobacco free or opt out of it. So if you're opting out of wellness, then you're going to pay more, because if you're going in for wellness, then wellness is more of kind of a preventative move or a proactive move. So if you're not going to be proactive and do some preventative things, then we're going to charge you more, is pretty much what that's saying. So just a quick overview, just really showing you the difference between, you know, if you smoke, if you don't smoke, if it's just you, or it's you and several other people on your plan. That's kind of what that difference would look like. All right, so thank you, Edna. Same thing, so we have low deductible plans, and this is really just, there go those colors, see that gold and that platinum. They really are just saying, all right, well, your employer is going to cover this amount, and then you're going to be responsible for this amount, but the total monthly premium is this amount. All right, so that's what that really boils down to. Your deductible is going to be this amount. Your out-of-pocket max will be this amount. And the deductible and the out-of-pocket max are two different things. I believe there's a slide further on that gets into that. If not, I can come back. More examples of coverages and differences between coverages and ages and smokers and those lovely bronze, silver, gold, platinum covers. So this is great. This right here goes into what I was talking about that bronze, silver, what that color really means. And that color really means this is how much you're going to cover. So if you're going for bronze, they're going to cover 60% of your expenses. You're responsible for 40, right? Because there's 100% cost. Silver is going to cover 70%, and then you're going to cover the 30%, and gold, and so forth and so on. So the higher in valuation of the metal, the more that the insurance company is going to cover, the less that you're going to be responsible for. And that's whether you meet your deductible or not. Okay, here's those wonderful out-of-pocket costs. So copays, co-insurance, how much does it cost to pay a primary care physician as opposed to a specialist, deductibles, out-of-pocket max, prescriptions, all that good stuff. So the copay, that's the amount you pay at the time of service, right? It could be $10, it could be $25, it could be $50, it could be $75. It just really depends on your insurance carrier and what the contracted amount is that you have to pay. And it doesn't, I don't believe copays, depending on your plan, always are calculated in your out-of-pocket costs, and I do not believe in most cases they go towards your deductible. All right, co-insurance, this is the great stuff. This amount differs dependent upon your deductible status. So, example, if you have not met your deductible, then your insurance may pay 80%, and that goes back to those metal valuations of your bill, and you're responsible for 20. So if you had that goldish kind of plan, then definitely they're going to cover 80%, and then you're responsible for 20% of your bill. And this changes once your deductible is met. So let's say your family deductible is $13,500. You meet that deductible, which is, and now it goes from 80-20 to them kicking in and paying 100%, as long as it's an in-network provider, just depending on whether or not it's an HMO or a PPO. And they both have in-network coverages and out-of-network coverages, but they still change what they will cover depending on the type of plan that you have. Deductible, that is the amount for covered services received during a benefit period. There we go, that period. That is the patient's responsibility. So most of the time you'll see, you'll have out-of-pocket maximum, and then you'll have a deductible cost. What you would like to try to do, optimum, is to have that out-of-pocket cost match that deductible cost. So they're similar in cost. They're not different. Sometimes you'll see a little offset, right? Your deductible will be less than your out-of-pocket maximum, and sometimes that's because they're calculating what your copays and other costs would be along with that. All right, out-of-pocket maximum, here we go. The most you have to pay for covered services in a planned year. So after you spend this amount on deductibles, copays, and co-insurance, your health plan pays 100% of the coverage cost benefit, or cost of covered benefit. In English, you pay all these things, right? All of your out-of-pocket maximum and all your deductibles and all your copays, and you're paying your co-insurance, whether that's 70, 30, 60, 40, 80, 20, whatever. And then finally, your benefits, once you hit that out-of-pocket maximum, which could be anywhere from $5,000 to $20,000 depending on your plan, the higher deductibles are really high, then they kick in and they cover that 100%. Okay, so love those metals. Annual deductible for one person would be $1,800. For a family, it would be $3,600. I think these are a lot higher in certain areas. This is from Kaiser. Kaiser is a HMO mostly in the DC, Maryland, Virginia area, but there's some out in California as well. So just kind of the out-of-pocket maximum, just running through that. So you would still have to pay your primary $50, as opposed to if you went to the gold, you pay $30. So you can see, there's less, the deductible is less, the out-of-pocket maximum, of course, is less, and then your copays would be less, but you would be paying a higher premium because the difference in the metallurgies. So specialty is 70/50. I mean, you can pretty much see labs and imaging. Then they talk about cost with the office visit, and it's 30% of your co-insurance. And outpatient for mental health, they have a copay. So that's, just a nice little, to sum up everything that was just discussed, it kind of gives you a nice little picture there. All right, options to offset your out-of-pocket costs. So you can save, you can plan. There's the HSA, right? And then the FSA. So the FSA is the flexible spending account, and the HSA, health spending account, I believe. And these are mostly for, you can have an HSA if you have a high deductible plan, but we'll go into those definitions very shortly. So health savings plan is a HSA. It's tax advantage medical savings account available to taxpayers in the U.S. who are enrolled in a high deductible plan. The funds are contributed to an account and are not subject to federal income taxes at the time of the deposit. So pretty much, if you have one of those high deductible plans, one that I was on was, I had a high deductible where the family deductible was about $8,000, and my employer put on a HSA card half of that. So they covered half of the high deductible. And then I was responsible for the other half, and we used that to pay for our doctor's visits and things along that nature until that deductible was met, and then the insurance kicked in. FSA's flexible spending accounts or a flexible spending arrangement is a special account you put money into that you use to pay for certain out-of-pocket healthcare costs. So this is that planning piece where you're saying, okay, last year we spent $1,500, in healthcare costs, and so I want to put away enough money to cover those costs, and I don't want to have to take that money from my income and my other financial responsibilities. So you would do something like this with the FSA. So you don't pay taxes on this money. You'll save an amount equal to the taxes would have paid on the money you set aside. The only thing with these is that some of them are kind of use and lose. If you put $1,500 and you only use $8, then the rest of that, the remaining $700, it's not going to roll over. So you just have to really plan that out every year. And that comes around that enrollment time, looking back to see how you've used it, if it's worth it, and then you can go from there. If it's something, some people put in a little bit, because then that at least cover, maybe an ER visit or a copay, or it'll cover, unforeseen prescriptions that pop up. You have an infection, of bronchitis or something, you got to go get an outpatient prescription. You didn't plan on that. You could just use that card to cover that cost. Now, aligning your insurance needs with affordability, that was discussed earlier on, and that's pretty much as you're approaching this period, sitting down and going, all right, what am I comfortable with paying? What am I prepared to pay? What do I have available? Do I want to pay more on the back end, and that means co-pays, deductibles, and out-of-pocket costs, or do I want to hit heavy early and take care of not having to be responsible for those costs? So that's that alignment piece. And sometimes alignment can look very confusing. I love these chickens. That whole thing with the hair, that's right up there with me. I would love to do that. So there's help. Google. You can always go and take a look at Google. What you have to be careful of with Google is just the site reference. Are they a reputable site? What is their background, the people that are giving you information, and then depending on their stance, you have to be really careful about how you use and implement the information that they're giving. Healthcare.gov is a great resource. A lot of it can be a little overwhelming if there are certain terms and stuff that you don't understand, but they do have free toll-free number that you can call and ask questions, and they're very helpful. And then there's PHMC, which is Health Navigators. They are certified to help you walk through, if you're going to use the ACA, walk through that process, answer those questions, and help you find affordable healthcare options. And then there's my company, KB Caring, Advocacy and Liaison Services. And I also work with clients on the back end. So if you have insurance, or if you have an employer that provides you with insurance, then a lot of people think that my time frame is now, because everybody's hot and heavy with trying to figure out what they're going to do, when they're going to do it, and how they're going to do it. But the way I like to work with my clients is from January through September. We've taken time set aside to look over how you're using, what your plan is, what you want to spend, how you want to spend. And then when your open enrollment time comes around, October, November, December, you may have to call me to clarify a few things, but there's a game plan in place. You're ready to go. You're ready to click the button, and you're pretty sure, if not 100%, really close to probably 85-90%, that this is the plan that works for your family based on how you all were able to use and navigate and access healthcare and the healthcare systems the year prior. So those are your options. Yay, open enrollment, my favorite time of year, because this is your chance to really sit down, and before you even come up with the New Year's resolutions, you can put something in place that will enable you and empower you to be able to make those New Year's resolutions happen, right? So if you want to go work out, or if you want to climb a mountain, you need to have health coverage. It's going to make sure if something happens to you as you're climbing that mountain, that you're not devastated with these huge healthcare costs. If you want to work out, sometimes the insurer, the company, they offer those wellness benefits. So they really want to get you out there and make you proactive. And being healthy and being active is one of those ways to be preventative in the care that you're, and long lasting, health, right? So open enrollment, my favorite time of year, love it. And so here's how you stay in touch. So I'm on Instagram, I'm on Twitter, I'm on LinkedIn. There's my email address. If you have any questions, definitely feel free to email me. And that's it. So questions, answers, you have my email. You can reach out to me on Instagram, on Twitter, through LinkedIn, and just let me know what's going on, what you're thinking of, and I definitely will get back to you. And let's see if my video really is not working. It's just, I'm so upset. You gotta love technology, right? So let's go back to that camera, right? Because there we go. All right, screen share, gotta love it. So if there's anything else that you wanna reach out and ask me, please feel free. And I hope you found this helpful, and take care. All right, bye. Okay, leave me.